Well, you see why we are so proud to have Johnny Isakson representing us in Washington. Thank you so much, Senator Isakson, for being here with us, for your incredibly enthusiastic support of this conference. He has been with us since the very beginning. It really means so much to have your leadership and to have somebody who understands, yes, that there are problems still to be faced in Africa, but above all, that there's so much promise. And I think that his message showed how much he is committed to being part of the partnership to realize the promise in Africa, not only in health, but more broadly. So again, thank you, Senator Isakson, your staff, for being with us, and Chris for that very nice introduction. I also just want to add my words of welcome and thanks to everybody for being here. This has been the last few years, 3 years that we've been doing this, just a wonderful coming together of people. And as I look around the room and see this crowd that is larger than it's ever been before, more diverse, when you think about all the different backgrounds that are represented here, this is really continues to be such a wonderful effort to be a part of, and I really appreciate all of you being here with us. It's now my honor to introduce our next speaker. Johnny Isakson, Senator Isakson, already gave a very, very wonderful description of the leader that Tom Frieden is. But let me just say a few more words about Tom, who is the director of the Centers for Disease Control, a great friend, a great leader. He's been director of CDC since June 2009. Tom is trained as a physician, internal medicine, infectious diseases, and public health, and really especially spent a lot of time focusing on tuberculosis, where he had the opportunity to lead efforts with the World Health Organization as an assignee from CDC to India, working on efforts there. He started his career at CDC back in 1990, starting, as many of us in the room did, as an epidemic intelligence service officer, stayed over a decade working with CDC, 5 of those years in India. He then went on to be the Commissioner of Health for the Department of Health in New York. And many people know of Tom's very brave and bold efforts around tuberculosis control, but tobacco control, and really led the nation in many ways in looking at this issue of our diet, the threat that trans fat and other products, the impact that they have on our health, and really looked at how a public health department could actually take the lead in looking at how you use the change in legislation as a way of actually improving our public health. He also did a lot to revolutionize health information with New York Health Department and other things, including looking at across the board at how a health department works with communities in a much, much more proactive way. So Tom came to CDC after really showing bold national leadership as Commissioner of Health in New York, and we're so proud and pleased to have him continuing to show that kind of bold leadership at CDC. He's had a range of incredible experiences since he came, including leading the nation's response around H1N1, and has continued in his commitment, his longstanding commitment to global health, which he will be talking about today. So I'm just pleased and proud to have as my friend and colleague Tom Frieden, who will start off and kick off talking about what are some of the challenges that we face in health in Africa today. So Tom, thank you so much for being with us.
Thank you so much, Helene, for that wonderful introduction, and thanks. It's always a treat to hear Senator Isakson speak about his experiences in Africa and his commitment and his understanding of how important our work is there. Thanks to CSIS, CARE, and World Affairs Council for bringing us all together. It's an incredibly important event, and thanks to Steve Morrison, Helene, the Honorable Raila Odinga, former Prime Minister John Rice, for being here. Fundamentally, we've seen more progress in health in Africa in the past decade than could have been reasonably hoped for or expected. But it's not nearly enough. Mother Teresa said, "Yesterday is gone, tomorrow has not yet come. We have only today. Let us begin." One of the biggest mistakes that individuals, groups, companies, and countries make is to compare themselves with the past and see that they've made progress rather than the potential, benchmarking against the best. So while there's much more progress that has been made than we could have hoped for, and while there's much more progress than is often appreciated, there is so much more to be done. Take HIV/AIDS. Senator Isakson spoke about it. I have colleagues who have worked in Africa for 30 years and describe the entry of HIV into their communities. They describe the devastation that it caused, not only in society generally, but in the healthcare sector, where doctors and nurses and health staff were dying in huge numbers, where the only business that was booming was funerals, where the very concept of being able to hope was becoming unthinkable. And with treatment, with the PEPFAR program, the President's Emergency Plan for AIDS Relief, with focus from countries around Africa, that has changed so dramatically over just one decade. PEPFAR alone has resulted in more than 1 million babies being born HIV negative who would have been HIV positive otherwise. 1 million kids who are going to grow up, contribute to their societies, become students, teachers, workers, leaders. The world is richer for that. In some countries, we've seen 50, 70, 80% reductions in incidence rates. President Obama set very ambitious goals, picking up the baton from President Bush, who started the program or expanded the program from some initial programs started in the Clinton administration, and set very ambitious goals in 2011 that by 2013 we would increase treatment under PEPFAR to at least 6 million people. It reached 6.7 million. That we would reach prevention of mother-to-child transmission of at least 1.5 HIV-positive pregnant women. That was done. That we would increase voluntary medical male circumcision, which reduces HIV transmission 60, 70% for 4.7 million men, and that was done. So there's been tremendous progress, but there is so much more to do in HIV. In malaria, we've seen tremendous progress as well with the President's Malaria Initiative. We've scaled up malaria prevention and treatment, cut malaria deaths almost in half, saved over 3 million lives worldwide. 90% of those deaths are in children under the age of 5. But we have so much more to do and so many threats, including the emerging drug resistance threats. In measles, globally, measles deaths have reached historic lows. In fact, since the year 2000, 14 million kids did not die from measles because of immunization programs. Coverage in Africa increased from 53% to 73%. Measles cases were down almost 90%. Measles deaths were down almost 90%. At CDC, we helped the World Health Organization and other organizations establish measles and rubella laboratory services in 47 African countries. And these gains have a huge effect on children's health. Bill Foege, former director of CDC and the Carter Center, worked for the Gates Foundation as well. Bill has described his work in smallpox, and smallpox eradication in Africa was not easy because though it's a terrible problem, it was not a very common problem, and it wasn't always easy to get parents and others interested in vaccination. But measles was described as the tugboat for the smallpox program because there was tremendous interest in measles vaccination. And we're seeing that with measles vaccination around the world. We're seeing that with meningitis vaccination around the world. A remarkable partnership. Gates Foundation, CDC, PATH, a non-governmental organization, the Serum Institute of India, to make a meningitis vaccine specific to epidemic meningitis in Africa that's endemic in what's called the meningitis belt, that works nearly 100% of the time, that's gotten into communities with a vaccination rate of over 90%, that's saving tens of thousands of lives. So we have a lot of success. And polio, despite setbacks, we are closer than we ever have been in the world to eradicating polio. Nigeria and Pakistan are the only two countries that are continuing to generate polio cases for themselves and other countries around the world. And Nigeria is extremely close to the finish line. They have fewer cases than they've ever had. They have higher vaccination rates than they've ever had. And for the first time ever, more than 3/4 of all children in all 8 northern Nigerian states received at least 3 doses of the polio vaccine. So we've made progress, particularly in the infectious disease world. And we've made progress by enlisting strengths of communities, individuals, families, teachers, traditional healers, and others. But there are so many areas where so much more is needed. Child mortality and maternal health are areas where we haven't made nearly as much progress as is needed. Child survival is up, but not on track to reach the Millennium Development Goal targets. We've seen big successes. I mentioned malaria. In areas where the malaria program has been implemented effectively, we've seen overall child mortality, infant mortality, go down by 15 to as much as 45%, because malaria is such a huge burden in so many communities. We've seen weak healthcare systems with poor sanitation and water, as Senator Isakson spoke about. Indoor air pollution, which is increasingly recognized as a major source of pneumonia. If you think about primary prevention, that is, prevention before something becomes a problem, clean water prevents diarrhea, clean air prevents pneumonia. And in neonatal deaths, we've made not nearly as much progress as we could or should. We also have seen very low rates of family planning. So in the maternal and child health arena, there are many unfinished agendas. Now, in the non-communicable disease, we don't have an unfinished agenda, we have an unstarted agenda. Because we haven't even begun to address what will be a tsunami of cancer, heart attacks, strokes, and diabetes, the vast majority of which are preventable. Preventable through simple interventions that are available today and that are not expensive. Take the cardiovascular disease example. High blood pressure is actually the only thing that kills more people around the world than tobacco. Now, we can reduce high blood pressure by increasing physical activity, by improving nutrition, by reducing sodium, but ultimately, there are a lot of people who need treatment for high blood pressure. I was in northern Nigeria a couple of months ago during a polio campaign, and one of the things that is done in polio campaigns is a health camp. Health camp provides general health services to people in that area. It's an important way of emphasizing that we care about the community and not just about polio. In that health camp, they had seen about 100 people by the time I got there, and they had a sheaf of papers, one for every person there. Went through those papers. There were about 25 people who were over the age of 35, mostly it was young people. Of those, most of them had high blood pressure. At least 4 of them, high blood pressure, high enough that in the US we would have taken them immediately to the emergency room. None of them were on treatment, and all of them were given a little bit of medicine for a month, which will not address their problem. And yet, treatment of high blood pressure is not complicated. In fact, in 1975, a study was done in the US that showed that nurses following an algorithm could do a better job treating high blood pressure than cardiologists. And this is an example of the kind of approach we need. We need approaches that are going to extend access, improve quality, and reduce costs. And task sharing is going to be crucial to that throughout the healthcare system. A second area of our unfinished or maybe unstarted agenda is injuries, especially related to automobile crashes and also related to violence, and particularly violence against women and girls. Africa has the highest road injury fatality rate in the world, nearly twice the world average. In fact, for Americans traveling around the world, the leading cause of death is a road crash. That's riskier than anything else around the world. I don't know what the sound system seems to have a little feedback, but I guess we'll be okay. We also seem to sometimes underestimate the impact of unsafe roads on economic development. Road crashes alone cost some countries in Africa up to 5% of their GDP, and it's increasing. And of course, poor quality roads are major impediments to economic development. And we know that the vulnerable road user, whether someone who's walking or bicycling, is at greatest risk. Violence against women and girls is widespread, and it's an example of a huge human rights problem. At CDC, we've worked with UNICEF and others to do violence against children studies. These studies are just heartbreaking. We find that in country after country, 30% of girls have been raped by the age of 18. And not much lower proportion of boys have been attacked sexually. The Boko Haram kidnapping is just one high-profile example, and it emphasizes just how important it is that we strengthen the role of women, because that will be essential to so much in making progress throughout the world, including in Africa. It will be essential to workforce, it will be essential to healthcare, it will be essential to societal progress. So there's a lot of unfinished business, and though we rightly celebrate some of the economic vibrancy that you see throughout Africa, economic progress alone will not guarantee health improvements. There are many poor people, even in middle-income countries, and the resource curse has real meanings for health. It means that governments don't develop the institutions that are needed to ensure their continued progress to the next level of development. It means that the parts of society that are in greatest need are least likely to get the services that they need. In polio, we're now seeing circulation in 10 countries, in significant part because of violence and insecurity in northern and northeastern Nigeria. In HIV, we've done 5 million circumcisions, but we have 15 million to go. There are millions of patients who need to be on treatment who aren't on it yet. We've yet to reach marginalized populations as effectively as we need to. We've yet to address effectively the role of women and reduce violence against women. Of course, all of this will get easier if we have a vaccine or a cure for HIV. But with today's tools, we could make so much more progress. As Helene mentioned, I worked for more than a decade on tuberculosis. And tuberculosis is a very interesting area to work on, as probably no one in here knows, but actually the way the world treats tuberculosis today was first established in Tanzania in 1979 by a collaboration, many different non-governmental organizations, the government of Tanzania, to figure out exactly how to do it right. But Africa today, with 11% of the world population, has 29% of global TB cases and 34% of deaths. And incidence is falling far too slowly. There are devastating outbreaks of multi-drug resistant and extensively drug resistant tuberculosis. And as a TB doctor from way back, it's very frustrating because, as with so many other things, what's needed most is what's ignored most. It's standard, core, basic services, making sure that patients are reliably diagnosed, effectively and sensitively treated, rigorously monitored, there's supervision so that patients can get cured. We know how to do this. We need to ensure that the healthcare workers caring for them are protected so there's not a problem with infection control in healthcare facilities. This is a huge problem in HIV, and frankly, it's a huge problem in the MERS situation, Middle East Respiratory Syndrome, which is spreading in the Arabian Peninsula, Saudi Arabia and UAE. The more we learn about it, the more we learn that the healthcare setting is the key amplifier of drug-resistant tuberculosis and of MERS. That's bad news for healthcare workers, but it's actually good news for all of us, including healthcare workers, because it tells us what we need to do to stop it at the source. I think fundamentally there are three things that are our greatest challenges for health progress. The first is a lack of infrastructure for public health. Information for decision-making, health monitoring, evaluation, and accountability. Far too often, we're basing decisions on bad data. It's like driving a car blindfolded. That's the situation we're in trying to set health policy without adequate surveillance data. Surveillance data will only be adequate if we have ongoing use of that information. There's lots of data collected all over Africa, but the proportion of it that's really accurate and timely and useful is quite small. Tuberculosis actually has a very good information system, and it's a model for treatment of chronic diseases. It holds the healthcare system accountable for every single patient cured, and it was established in Tanzania in 1979. One of the kinds of things we need to have is vital registration systems. We don't need more models for guessing how many people are dying from what. We need actual information. That information will allow us to figure out where we need to target our efforts, whether they're working. If they're not working, we can improve them. We need objective and effective monitoring and evaluation systems that look at outcomes, not just process indicators. So one part of the healthcare system that we need to improve the public health system is the information part, because that's the lifeblood of making progress. The second part is accessible networks, clinics, transportation to clinics, comprehensive health services. And that will require trained, motivated, and paid health workers. Task sharing is going to be crucial. There's no way we can expand access, improve quality, and reduce costs or maintain the cost envelope without dramatically improving our use of all members of the healthcare team. Task sharing is crucial. The second major challenge we face to global health progress is conflict in fragile states. This threatens all of our advances. It interrupts supply chains. It interrupts health facilities. It increases vulnerable populations. In Borno and Yobe, two northeastern states of Nigeria, violence has resulted in children not being vaccinated for polio, and last week we had another polio case there. Disease is relentless in finding the weaknesses that we have in our system, and good governance is going to be so important, and safe countries are going to be important. We can't do a lot about safety within the healthcare field, but at least we can make clear what the costs of not having that safety are. The third biggest challenge we have is pessimism. Great things can be accomplished if we make great plans, but make them practically. There's so much that we need to do. We need broader systems. One of the things that we need to do is to strengthen our use of public health institutions. Senator Isakson talked about in Tanzania, there is a growing National Public Health Institute that's a mini CDC, if you will. That's exactly what we want. I've traveled to dozens of countries, and in virtually every single one of them, I'm asked, how can we have our own CDC? We would love to help countries do that. There's nothing that would have a bigger impact, a longer lasting impact, than to help countries develop their own institutions, their own information systems that they can use to advance health progress. We've been doing this through a program called Global Health Security, which helps countries find, stop, and prevent health threats wherever they may occur. Now, you'll hear about exciting things like work that we do going in and stopping epidemics, and that's important. Many years ago, the US ambassador to Africa said to me that CDC is the 911 for the world, and I thought, that's wonderful. But the more I thought about it, the more I thought, you know, we actually want every single country to have its own public health 911, and that's what we're developing now. And Africa is top priority for that. National public health institutes are critically important in doing that. We build on many successful programs like field epidemiology training that's trained more than 3,000 people for 2 years to be disease detectives in their own country. 80% of them stay in their home countries. That includes transitioning vaccine programs, taking that infrastructure we're developing in polio and measles and strengthening routine immunization, comprehensive immunization services so that we can make much more progress in the future. The second broad area we need beyond building public health institutions is strengthening integrated cross-cutting approaches. I'd like to mention one, Saving Mothers, Giving Life. It's a program that we began in Uganda, Zambia. It was an initial program. It was a proof of principle. There are a lot of things that could get better with it, but fundamentally, we said, is it possible to cut maternal mortality in half in 1 year? And we don't have all of the outcome variables that we'd like, but we either reached that or got very, very close. Because for maternal mortality reduction, the fundamental issue is access to emergency obstetrical services. And one of the things that wasn't done there, but it's done in many countries in Africa, is to extend those services through task sharing, through a team-based approach, through surgical technicians who can do just as good a job, who will go to communities that will never be served by obstetricians, and who will go and do that 24/7, 365, saving lives. We saw in that program huge increases in facility-based deliveries. I was in one facility and they had a wall chart, handwritten, of the number of deliveries there. And from before to after, there was a 10-fold increase in that one facility. And when you talk to the women, they were giving birth in extremely unsafe situations before. They solved the transport problem. They addressed the access problem. They made a huge difference. So there has been significant progress, more than many people realize, in improving health in Africa. But that progress is very fragile. Economic growth won't automatically improve health outcomes. There are huge gaps between what has been done and what needs to be done. Optimism will help us succeed, but it has to be realistic. To make progress, we need to be strategic, focused, and pragmatic. We need specific programs that specifically achieve measurable outcomes, but also build systems. We don't need either impassioned pleas that aren't practical or breezy optimism that doesn't look at the challenges that we have to address. But pessimism is also unfounded. We have proof that it can be done. Many things that no one thought would be possible are now taken for granted in dozens of countries throughout Africa. It hasn't been easy, and the future may be even harder, but success leads to success. I started with a quotation from Mother Teresa, and I'll end with one by Mahatma Gandhi. Gandhi has a very interesting history. I loved Senator Isakson's analogy between what Martin Luther King Jr. said about injustice anywhere being a threat to justice everywhere, and the same being true of disease. You know, there's a very interesting back and forth between Eastern philosophy and Henry David Thoreau, who wrote Civil Disobedience and focused on what could be done to improve how the government acts, and Gandhi, who read Thoreau, who had read the Indian philosophers while Gandhi was in jail in South Africa and developed his philosophy of active resistance through nonviolent means, and Martin Luther King Jr., who coming from the same country as Thoreau, read Gandhi's work when he was in jail and refined the concept of making progress through ongoing struggle. And Gandhi said, "The future depends on what you do today." And today we can make so much progress. We have technical tools. We have communication tools. We have ways to collaborate and cooperate and communicate among ourselves that we have never had before in all of human history. Together, let's use those tools to work with African communities to improve health. Thank you very much.